So we are studying about muscular and skeletal radiology. So in my previous class, we discussed about inflammatory and non-inflammatory arthritis and what is the sign, what is the difference between inflammatory and non-inflammatory arthritis. Today we'll discuss different type of arthritis. So first is osteoarthritis. We'll discuss. Next is erosive arthritis. Third one is rheumatoid arthritis. So these are the three types, different types. Others also there, we'll discuss later. So today we'll discuss these three types of arthritis. And the other we have psoriatic arthritis, gouty arthritis, and pseudo gout. Okay, these are the different types of arthritis, which is very, very important in clinical practice. So first we will discuss osteoarthritis. So we have to remember five things about osteoarthritis. Okay. What are the five things we'll discuss later after seeing this image? Okay, you can see this image. This is osteoarthritis. Okay, so this is the cartilage. We have that, and we have this bone. Okay, and we have meniscus also, joint space. Okay, so in the osteoarthritis, first what will happen? Next image, you can see this image. You can see this is the another image. This is the lateral medial side. This is lateral side. Medial side, inner side, lateral, outer side. You can see this is the femur bone, tibia bone, fibula. This space. Okay, the space is very very important. Okay, space narrowing is the golden standard. You can see in osteoarthritis. So in the osteoarthritis, the first thing you have to remember that narrowing of space. So whenever X-ray comes to your clinic of knee joint, any joint, so what will happen? We have to observe narrowing of space in the medial side, or we'll call asymmetric joint narrowing. Asymmetric joint narrowing. Second symptoms or second clinical features you can see that in the X-ray, that is periarticular sclerosis. Periarticular sclerosis. This is the second thing. What is meant by periarticular sclerosis? In that image, there is a chances of overgrowth of fiber connective tissue, or you can say the hardening of the bone tissue. The we can not able to move the joint very freely. Flexibility. Okay, movability is very hard. So this is the second thing we have to remember. So whenever you can have to advise the patient to move the joint, you will tell there is a hardening, tightening. Okay. So this is the second thing that is called periarticular sclerosis. Then third one is osteophyte. What is meant by osteophytes? Osteophytes is nothing but bony growth at the edge of the bone. Bony growth at the edge of the bone. You can see here. In this, you can see this the osteophytes here. Osteophytes here. You have the second. You can see osteophytes here. This is the third. First is space narrowing, and this is the osteophyte. Okay. Second is periarticular sclerosis. Third is subchondrial cyst. In some areas, you can observe to cyst like water bubble like thing. Okay, that is subchondrial cyst. Then last one is mostly large joints are involved. Fourth one is subchondrial cyst. Okay, cyst, and fifth one is large joint. Most of the osteoarthritis affected of large joint. So one side is affected, narrowing of the space, sclerosis, osteophytes, subchondrial cyst, large joint like knee joint, okay, hip joint, elbow joint. So all this large joint or shoulder joint, weight bearing joint, what we will call weight bearing joint is affected mostly. Okay, so this is the thing we have to remember, and this it is degenerative type, non-inflammatory type. Okay, non-inflammatory type. Next type of osteoarthritis, this is erosive arthritis. Erosive arthritis. Okay, if a patient have pain mostly in the hands, this affect on the small joints, small joints. Other than osteoarthritis, erosive arthritis start with small joint. This is we have to remember small joint, mostly hands and legs. Okay, phalanges, metacarpus, carpal bones, wrist joint. Likewise, it will come from distal to proximal. Okay, this is the thing we have to remember. And second one is patient doesn't have any type of fever, weight loss, or any redness. Okay, every report is normal in erosive arthritis, mostly rheumatoid arthritis, CCP negative, CRP, ESR, everything is normal. So means that erosive arthritis. What will happen in erosive arthritis? All the small joints will affect. You can see this image here. So we have the small joints in the hand. This is called phalanges, distal, proximal. Okay, and here metacarpals. This is the metacarpals, metacarpals, and phalanges, proximal and distal. So all the PIP, DIP means what we call proximal interphalangeal joint. This and distal interphalange joints. All are involved. Okay, all are involved. And the sign is eagle appearance. What we'll call seagull appearance. Like eagle is flying, like appearance you can see there. Okay, so this is the second thing, and all the tests are normal. Small joints are involved, mostly phalanges, distal, proximal. Distals are these are the distals. They are the proximal. Okay, away from the hand is distal. Nearby the hand is proximal. And other than that, metacarpals also affect. Wrist also affect. Gradually, the inflammation or pain will increase from distals to proximal. First thing is, and that is stiffness in the morning. Means the stiffness is present in the early morning. Gradually, the stiffness will go away. So this is the second thing we have to remember about erosive. The reports are normal. Pain is coming from the distals to proximal, from starting from small joints. Third one is a patient have morning stiffness in the hands and the legs. Okay, this is the third important thing we have to remember. Okay, so this is called uh, erosive osteoarthritis. Next is rheumatoid arthritis, very very important. Now very common, rheumatoid arthritis. Rheumatoid arthritis means everything is positive: CRP, CESR, RA factor, CCP. Okay, everything is positive. Okay, so this will define that the patient have rheumatoid arthritis. How the patient come to our clinic? The patient have pain, swelling, and okay, swelling. Okay, morning stiffness. Okay, and gradually the patient condition will improve. Okay, the patient has swelling in the hands or legs, and morning stiffness is there. First is morning stiffness. Second one is pain and swelling in bilateral hands, both legs. Okay, this is the thing. Here, one thing is different from the erosive arthritis. That is, in the erosive arthritis, the distal and proximal both are involved, but in rheumatoid arthritis, wrist is involved, MSP, metacarpal joint is involved, and PIP, proximal intraphalangeal joint are involved. But DIP is not involved. Distal intraphalangeal joint is not involved. So it is very important. And third thing you have to remember, it is the symptoms, but here, other than that, third, fourth one is that the patient have marginal erosions. Marginal erosions means the articular cartilage is damaged. Then the synovial joint is involved. So this is we call marginal erosion. You can see this in this image. So this is the image. The marginal, this is the cartilage is damaged gradually. You can see the swelling of the bone erosion is also present. Marginal erosion is present and swelling in the synovial fluid and inflamed. Okay. Joint space is reduced, but bilateral. It will happen in both the legs, both the hands. This is very important, sir. In osteoarthritis, only one side effect due to the age, but it is due to the any it is autoimmune disorder. Okay. What are the features? How it looks like? Or already I told you that this bilateral, symmetric, both hands, okay, both legs are involved, and joint space also reduced. Joint space also reduced, decreased, and the patient can see that's osteopenia. Osteopenia means decreased mineral content in the bone, so there are the chances of fractures and fell down. Osteopenia means weak bone, decreased mineral in the bone density. Okay, next we have the first it starts with small joints like in the bone erosion like this. Gradually large joints are involved. This is the very important things. So if a patient in come to your clinic, if you advise to show his hand, also the hands will become like ball catchers view. What we'll call ball catchers. Like is that the hands will become like how we catch the ball, their hands become like that. So we'll call ball catchers view. So this is the important clinical sign. Ball catchers view. Okay. Ball catchers. So it will also affect the hip joint gradually. It also affect knee. So you can able to see this image like how the knee is involved. You can see that this is the narrow space narrowing occurred. Okay, and after that you have osteopenia, bone density is reduced. Okay, and after that you can see that uh, the synovial fluid also reduced. Okay, and it is involved. Okay, and a patient has swelling, pain, okay, morning stiffness. All this you can able to see to this patient. So it will affect small bones, large bones, okay, and also it will affect the skeletal spine, okay, spine also is affected. So all the joints will affect, okay. So this is the how you'll able to see the clinical features according to the radiology. So this is all about in today's class. Okay, tomorrow we'll discuss other different types of arthritis.